person, well known, to share her expertise with us, and we are privileged to be here to listen to her and to gain much knowledge from her. We welcome you, dear sister, very lovingly into our midst.
Soumya some 3 months ago told me that she wants to organize a seminar on healthcare, because healthcare is in shambles, we know. So then I said, conveniently organize your date and I am available as such. And for those of you who have attended the retreat, it may sound an overdose, but believe it is the other side of the spectrum. So you will have to pay attention and stay tuned. So here we go. Can I get a beautiful smile on your faces? Yes. Everybody, cheer up, because no, it is the cooling system of your heart. So you need to cheer up, and it beautifies your face also. And it is the sparkling system of your eyes. Let me see the eyes sparkling. Yes. And it is the lighting system of the face. Face start glowing when you smile, and also it is the relaxing system of the mind. So this is a time of relaxation. Even if you sleep, don't snore. Okay? So my request, humble request to all of you is to activate all your systems with your sweet smile, and I wanted to tell you the best response to any situation is smile. Smile, even without words also, smile. Even if it is bitter, smile. That's how it is. Even our thoughts have got a ripple effect in the atmosphere where we are in. Even thoughts, not necessarily words, even thoughts will affect. So, positive thinking. This universe is constantly listening to our thoughts. Please believe that, sisters, every one of you, professors here sitting, your thoughts have got an impact. So if you are thinking about your spouse not being good to you, mind you, it will affect them. The more positive thinking you do, the more positive energy you will receive. So if you want to be energized, stop thinking negative and think positive. Success is success. Struggles are there, no? When we have positive attitude, this success is achievement. So I know you all want to achieve in life. Sisters, who of us in life has not experienced headache? Anybody? Toothache? Anybody who has experienced malaria? Cerebral malaria? So such people will know perfectly 9:30 I am taking class, I am perfect. 9:30 to thoda sa dard ho gayi hai. 9:35 अच्छा नहीं लगता है. I am feeling very cold. Start shivering. The next minute you are not able to keep standing. Okay. So sickness, what does it make us? We become victims of sickness. Suffering begins, and when suffering comes, we become vulnerable. The example I can give you is about a software engineer nowadays. These are the people in high-fi positions in life with huge money. Okay, 38-year-old man, he has got a very, very lucrative job, flashy lifestyle and vehicles, everything is there. Morning 8:30, he gets ready to go to the office. Hardly 10 minutes on the road, he meets with a very bad accident. Okay, till now perfectly everything was okay. Now he has got a cut on his forehead, hands are broken, hanging, leg is not there like he is feeling. He's become miserable, he is vulnerable now. He is at the mercy of a strange passerby who, if he is a good Samaritan, will bring him to the hospital or to any clinic for support care. Now, this is a situation, people create an opportunity to exploit this vulnerable person. This is what is exactly happening to the whole human race right now with the advanced everything. I have due respect to all the medical professionals sitting here, doctors also, but you know, we as a group of Christian medical professionals, we have a different outlook to this suffering. And when human become vulnerable due to sickness and suffering, we do not want to make it an opportunity for exploitation. That is what the mandate of Jesus Christ. Now, healthcare was a service profession. It was to, we were caregivers to make people completely, to leading them to wellness, wholeness. That was it. But with advanced technology, science, from the 70s onwards, in our country, in Europe, in the West, it started in the 50s also. People started making, means lot of researchers, and then best way to mint money, to progress in business is to do healthcare, which has turned into a industry. It is the easy money minting business. Now healthcare industry right now, all over the world and in India also, is ruled by three major industries, and number one is the drug industry. Now we have all been, we have actually, those of us who are alive today has got a real gripping reality before us, the COVID-19. We have seen what this has done to us. I will be showing 2-3 videos subsequently to this, and please pay attention what it has done to us. This global economy is controlled by drug industry. Please know that. And this drug industry created myths about health, myths, mystifying health in the hand of the customer, the patient. For example, 40 years, WHO has published, but American health science journals have published it about 6 months ago, of the myth of cholesterol. I will show you the video very soon. This cholesterol, no? Cholesterol is a myth created because pharmaceutical scientists found that if you declare a person having high cholesterol, and if you start a medication, that particular medication, pharmaceutical industry invented it, it has got an effect on your circulatory system. Resultant effect of cholesterol medicine is increased blood pressure. So 6 months you take cholesterol medicine, start with cholesterol because it doesn't show any symptoms. They propagated health checkup and blood test showing whatever. And then when you take medicine for 6 months cholesterol, automatically your blood pressure will show higher parameters, and then you will be additional drug, blood pressure drug also. Within 1.5 to 2 years, obviously your pancreas will be put to death forever, and you will be a declared 3rd degree, also 1st degree cholesterol, 2nd degree hypertension, 3rd degree diabetes. So every human is now doomed, or for life 3 drug dependent we have become, and most of us, you examine, and few lay people are sitting here. When with the support of Tata Institute of Social Sciences, there was a research conducted, and those who utilize and who has taken for a ride by this pharmaceutical mafia is the consecrated men and women, because they could afford it. So this drug industry is one in, and number 2 is the diagnostic industry. Former times, suppose you are suffering from headache, your physician, family physician concept was there, and the physician will try to rule out the reasons for your headache. One, it could be lack of sleep. Number 2, dehydration, less fluid in the body. Number 3, blood sugar is low. Number 4, some tension, stress. These were the 4 predisposing conditions for a normal headache. This is what normally former times, 30 years ago, 40 years ago, in our childhood, we would have seen. This was how doctors treated patients. Now, with this modern technology and everybody having this kind of gadgets in the hand, everybody, this gadget is another reason for alarming situations in the life of humans. Now, again I am speaking about this 38-year-old software engineer. He has got a headache, and one day wife found that he was sleeping, so she also encouraged, let us go to the doctor. So the next day he went to the doctor, and doctor didn't even name and all, he wrote headache. Doctor have come for headache. So he rounds the eyes, forehead, headache, headache. So without even looking at the patient, without even getting an eye contact or a physical contact, he will pull out a prescription pad. Immediately he will write a CT, because he is getting a cut from the CT man, okay, for this investigation. Now wife is along with him, and now he calls all the contact members, in-laws and everybody. You know what? We have come to the doctor. He has prescribed CT scan. By the time this healthy 38-year-old gentleman starts growing a tumor in his head, starts in his imagination. And then he goes to the CT whatever, and it is an old-fashioned 16-slice CT which has not much of a clarity, and he will come back with this report maybe in the afternoon only. By the time the headache is not relieved, so doctor will ask, how is your headache? Doctor, it is very bad. Really? A little more anxious expression, really? And then he has seen, you know what, this is an old 16-slice machine CT and it has not shown, better get a MRI done. Okay, MRI. Now everybody in the village, not only in the village, in the town, in his office, our so-and-so Mr. X, 38-year-old man, is advised to have a MRI. MRI also came, next day only report, 24 hours gone. How is your headache? Doctor, it is very bad. Really? All the more night. By the time this benign tumor became malignant in his brain. Okay, so now he will come back with the MRI. Nothing in the MRI. Now what he will say? Headache is not better. He will say, you know, your headache, here also nothing much, but I give you some medicine. You know, he will give 3 prescriptions. One is a very severe painkiller, which all the mucosa from the tongue to the last portion, everything will be eaten up with this strong painkiller. And not only, he will give also a antacid and a enzyme tablet. Nowadays we have all these combinations available, pharmacists are taking here. So diagnostic industry is also mushrooming. The drug industry, diagnostic industry. Now the third industry is called the hospital industry. What is this? 102-degree temperature, healthy woman or man in their 20s, 30s, you can get a consultation and a bit of medication and maybe rest, lighter food, etc. You can go home. Now occupancy, because this facility is created with much expense and very hotel-like structure, no? Occupancy, so hospital industry admission. Little breathing difficulty is there, 1 injection and little rest, maybe little drip is okay, but breathing difficulty, immediately admission to ICU, okay, occupancy. Sisters, I am speaking about it because I have a little taste of the corporate hospitals. From that, it was a give and take experience for me. I was learning, was doing a lot of research. Every consultant is given a target to revenue maximization, profit, more profit, much more profit, profit maximization. That is the mantra of the corporate hospital. So industry is mushroom flourishing because of the 3 industries. So one example I want to give is in 2016. Nowadays, due to all the insecticides and pesticides and all that, the food we ingest and eat, it affects our entire system. So this Cipla is a pharmaceutical company, quite famous, and Pfizer is also another pharmaceutical company. So they decided they will manufacture a combination of a antacid and an enzyme together. Okay, combination, same. And so Cipla prepared a tablet, the name was Pribaxe, and 10 tablet strips. And this Pribaxale was a combination of enzyme and antacid, and the retail price was rupees 95. 1 लीजिए 6 rupees. Okay, now I want to tell you the secret of the retail price. You know, I did my studies, and during that, the way back in 95, I was given to do the costing of a Coca-Cola. This big bottle, you know, somewhere I saw that big bottle. 2.5 liter former times Coca-Cola was there. So my exercise, I visited the Coca-Cola factory in Bombay, and my exercise was to do the costing. And this particular 2.5 liter in 95, this was costing 45 rupees. Okay, 45 rupees was the MRP. As per the costing, in costing exercise, we apportion the profit also. Okay, marginal costing we call it. There are accountants sitting here, they will know. In marginal costing, the profit percentage varies. Normally 20 to 30% is the profit. Okay, we apportion that much. So MRP is inclusive of that profit also. You understand? Everything together. Now this after doing the costing for Coca-Cola, the 2.5 liter Coca-Cola, which was written MRP inclusive of taxes 45 rupees, the manufacturing cost including 30% profit was 1 rupee. 1 rupee, such me, I have done it and I got it accepted by the university also. I have it still in my records. So what I am telling is, so for this Cipla, when the 10 tablets were given, 59 rupees. So one tablet costed only 5 rupees 90 paise. Now the Pfizer company is much more famous, and then Pfizer company, again creativity, 14 tablet strip, and the name was Lyrica, and one tablet was costing 54 rupees 90 paise. Are you with me, sisters? Yeah. So the chemical composition was the same. Now the concept, the human thinking is what is costlier is better, isn't it? That is the concept. Now you see how the human psyche is exploited in the name of supporting sickness, and this is how we have been taken for a ride. Only 10% of the population worldwide had thyroid deficiencies. 10% only, thyroid deficiency. Now it is 70% of the population suffering from thyroid problems. You know reason? Iodized salt. Iodized salt was a product for business manipulation to maximize profit, and all of us shifted from natural salt to iodized salt because the advertisement were so strong that, and this is the result of thyroid. Now 2020 March, nobody will forget, COVID-19 shutdown has happened, right? There were, you know, this was a sudden onset. Before ever the symptoms were made visible, already the test kits were plentifully available. You understand, no? Test kits were already available, plenty. And then who said these test kits were the real cause finding? Who did any research on that? All these putting and hurting people, and they were all not true. These were all made, and then those days for travel it was mandatory also, and when government subsidized it, it is the cost of what was this test called? RT-PCR. It was 250 rupees only for the government, but I have travelled 1,800 rupees per RT-PCR we have paid. Okay, this was all. It was all in the thing. Then now suddenly, without testing it on humans, they popularized the vaccines. I would never have gone for the vaccine, but for the travel requirement, it was mandatory. Okay, and then first dose, second dose, then came the booster dose also. Booster dose, I thank God till now I have not taken. I did not already long ago, this corporate experience, I have a group of very good professionals who will converse with me also on intellectual matters and all these healthcare problems, etc. They also told they are not going. I said I am also. I already didn't want to do the first 2 doses. Now one of the neurosurgeons in Manipal Hospital, Bangalore, he had his 3rd dose booster a week ago. This particular day he was in the operation theatre, famous neurosurgeon. He was already operating from 8:30 onwards. 11 o'clock he completed the first case, he had some refreshments, and the second patient was already anesthetized, put on the table. He changed, and in the surgeon suit he was positioning the patient to do the surgery. He dropped dead. There were several anesthetists in the room. There were co-neurosurgeons with him. Physician was there, intensivist was there. Nobody could do anything. He dropped dead. And then there were speculations also that these vaccines could be the reasons. Okay. And then thereafter, successively we are hearing every day newer, younger deaths happening across the country, across the world. And Indian healthcare system, we have a lot of challenges. And one such is corruption. There is a small video which I will skip now because already 11:20, little more I want to tell, so I am skipping that video. See this in our Indian context, there is a excess of corporate health centers all over. We call it, I am only using the word corporate hospital colonies versus mission hospitals. Now that is my focal point. These are other facts I have to throw light on so that you understand where we stand in relation to our healthcare. Most of us are really angered to lot of pills, so the number of pills we are swallowing, and every time when we swallow a pill we need to think twice. So about mission hospital, corporate hospitals, how they have caught the attention of the people. The hospitals are located where easy accessibility. They will do the market study before they set up, there should be good roads and there should be access to airports, railway stations, then IT professional should be around, hotel facility should be such locations only they are choosing to set up a corporate hospital. This is how they are attracting. And then they get a lot of investors to support, because you see, if the COVID was a creation of, including WHO and UN, all the social organizations like Gavi, Global Alliance for Vaccination and Immunization, these are all philanthropic we thought, but everybody was in hand in glove with money and eating away human lives. So that is why rich investors find themselves partners to it. That is why share markets are available in the corporate hospital. It is sold as shares. And high professional tactics, they use all kinds of professional tactics are there, IT profession, everything related to, and they have also a lot of political support. Buildings can be constructed without the necessary permit, and equipments can be bought and installed without the necessary legal support. Commercial marketing they do also, medical tourism market. These are, roughly, I am just listing a few. This is how corporate hospitals do the work, and they are also able to, because they charge enormously, they are able to attract human resource at high cost, because they can give returns in such satisfied. Whereas mission hospitals, the charitable mission involved. That is how we are experiment than expertise. Why I use the word experiment is because the corporate hospitals are flourishing. We have also adopted cut, paste little bit, copy, paste kind of a structure. So that is why experiment. We are trying to copy them than using our vision and reasoning, and our expertise is missing also. then compromised manpower. Because our paying capacity is less, we are compromising on the manpower cost. We are not able to, lack of professionalism, our management, professional management, so it is not there per se, and then no marketing strategies. We think that what the right hand does, the left hand should not, no kind of a biblical concept has followed up, and so we don't know to make things known to people what we are doing here. So, mission hospitals, most of them are, for corporate hospitals, the ownership of it is a company, no? So there is ownership, whereas administrator is a time-bound job for mission hospitals. So she is all the time with burning eyes and crying hearts, he or she, lonely in the midst of so many. Whereas for corporates, they are supported strongly, and she is also hard-working but hardly understood. Because we all know that why I use the missing child syndrome is to explain all this. This is how it goes. And controllers, but she is a controller, but with consideration, compassion of Jesus, and loving but not able to show it. Because for us, love is, if we express and show it, it is termed as, understood as, or described as weakness, and power should be rough and tough, like understanding. So, do we ever support the management? The question is to us. We are here for a little soul searching, that's why I am putting this. Do we give them appreciation for whatever tactics they are applying with their limited resources? Opportunities are not there, exposure is not there, professionalism is not there. So, defend them among the co-workers. When the co-workers find fault with them, do you defend them or join hands with the support team? Because we are also struggling for our survival. Talk nice about them to public. Are we advocating our own healthcare facilities to people whom we meet while we are outside the context of our premises? Do we comfort them? So these are a few questions, no? Do we ever do this? And then, what can the nurses do? Because in our context, no, the domain is controlled by the nurses, no, our own team. So what can the nurses do? Patient-friendly service, to make it more patient service excellence, to retain the service excellence of Mission Hospital, charity in action, quality in care. That is, I am giving thoughts only, and accuracy in bills. Many times our patients are dissatisfied because they have shelved the hard-earned money, okay? And sometimes all that is bought is not used for them. So that is why accuracy in bills, reduced wastages, power, medicines, stationery, consumer. You know what? There are elements where we can really focus on to make our healthcare more effective, more patient-friendly, more pocket-friendly also. So, empower fellow nurses. How do we support our fellow nurses? These are our questions. And then talk to patient party. How much is our contact with the patient's relatives? Corporate hospitals have got communication experts. Every time in front of the ICU, there is a communication team coming and updating. And these are all professional strategies to attract patients. Just today I have an information, my own cousin sister, my mother's sister's daughter, she is living in Bangalore. She has only one son, employed in a corporate, he is in a big position. She suffered little chest pain on Saturday night at 8 o'clock. She was taken to one of the big corporate hospitals in Bangalore. They immediately admitted her to medical ICU, telling that she has a serious problem, and they said she should undergo angiogram immediately. But Saturday 8 p.m. she was admitted. Till now angiogram is not done, and they have done n number of investigations, and every 10 minutes, half an hour, some updation will come. These are all suggestive of so many blocks, 80%. Then today my nephew asked, if it is suggestive, why are you delaying this angiogram for so many hours. Now, if it is suggestive, do it fast. Now, this is the mantra. They do all that. You know, corporate hospitals are. And then what was our identity as mission hospitals? Now, we were health workers. We have done a lot of home visits. We did community services, and our small health centers, clinics, dispensaries, they were. And then who supported us? Benefactors from foreign countries. Our own parent organizations like Mother House supported us. Foreign agencies came. Indian government supported us. And also Indian locals. There were social organizations also like Lions Club, Rotary Club, etc. Now, who are we now? Large hospitals, busy staff, institutionalized care, decision makers, managers, administrators. Our people contact has reduced, power without affiliation. That is one of the major problems. That's a big topic as such, power without affiliation. Due to time constraint, I am stopping, not explaining, and individualism also. Because we don't want to share our expertise, share the lessons learned from our crisis management situation. No, we are too much individualistic. Even within one province, 5 hospitals, between the 5 hospitals, no knowledge will be shared, no technology will be shared, no lessons learned from experience, bad experience will be shared. So individualism, everybody wants to show that I was better than the other. Diminishing witness, that is also happening with us, and profit in the name of sustainability. We said we should generate the running cost. That is what is called sustainability. But instead, aren't we also making profit? Very big question. Where did we create this infrastructure? How did we manage to upgrade the technology? Technology adaptation, I call it. So how did we? So that is, we are also known to be. Then challenges what we face are unavailability of clinical experts, attrition of medical personnel. We find it also now, especially in rural areas, how difficult to get doctors, lack of funds for technology adaptation, patients opting for efficiency and popularity. They want best care. If, at least for us, BCM here, we are still popular, this is the choice, but there are competitors sitting and taking our efficiency away, our popularity away, our values away. Ready access to Google. That's another deceiving thing. You see, Google is good, but when it comes to medical knowledge, Google is a deceiver. Please know that. All that the Google says about any sickness, any symptoms, any interventions, any medications, they are not to be blindly believed. Then violence against the hospitals. We are also experienced, may not be here, but we have also experienced. What is USP? Unique selling point. Mission hospitals were known for our empathetic care, excellence in service excellence, but that has also shifted. This is how, and lack of efficiency and expertise. We know what is our knowledge level, what is our performance level. These are all questions. So, inexperienced workforce, challenges from nurses attrition, highest turnover, compromise in quality, unprofessional supervision. You see, when it comes to supervision, we are also lacking in it. Because for every 10 employee, there should be a supervisor. That is the professional management mantra. But here, for us, supervision is what, inverted commas, I can give you examples. They are not properly done also. So, this is what, and I see people leaving. So I think people are, lack of time, Challenges from government is also there. Formerly, PHCs and CHCs were not functioning properly. Now, improved health system is there. Free medicine and diagnostics. This Amrita pharmacy, then the other pharmacy, what do you call it? Government pharmacy? We have it also here. Harassing rules and inspection of finance. Private providers in district hospitals. So, heart department of district hospitals are run by Apollo Health, Fortis Health, like that. Privatization is happening. tertiary care district hospitals to be made medical colleges. Our Prime Minister has declared, 50 medical colleges in UP alone, that, So every district to have one medical college, Clinical Establishment Act. The real care, rural areas, healthcare which we used to give, we are not able to give because of the implementation of the Clinical Establishment Act, because a nurse is not allowed to give even a paracetamol, right, without the availability of a doctor in the premises. So these are all there. Then identity, we were health workers, we did a lot of home visits. Now we work for banks and companies. Banks because money, everything is in the bank. We have no Google Pay, all kinds of payments are happening. And then companies, because technology adaptation, we are dependent on the companies of whether it be pharmaceutical companies, disposable companies, equipment companies. We are dependent on them. Then community health services we used to do a lot. Now we have become strangers to the neighborhood. Isn't it? It is very true, no? How much of public health conduct we had attached to our hospitals and institutes of nursing education, medical education. Now we have become strangers to the neighborhood. Dispensaries, small clinics, etc. Now healthcare business, we have become owners of huge setup. So this is how financial support system. Benefactors from foreign countries helped us, but they are now dead and gone. Foreign agencies, we lost our credibility because the purpose for which this particular money was given was diverted and used. So we lost our credibility. Indian government do not want us because they want to support, because 2017 health policy of India, there is no mention of charitable hospitals, only government hospitals and profit hospitals. Not for profit is not even mentioned. Previous health policy had it, that's why they don't want us. Indian locals, they do not trust us because they have seen also in the name of sustainability we are also making profit, so they don't want us. Social organizations like Lions Club, Rotary Club, etc., they started doing it themselves also. You understand? So this is how the system is. Now relevant questions. How many poor come to us? Simple question. And how much is our charity? How many home visits? What community services? Where is the reflection of compassion? Who do we empower? This is simple questions, and at whose cost? If we are doing something, for whose benefit and at whose cost are we doing? These are the questions we need to ask. Sisters, are you getting bored?
No.
Huh?
No.
Does it make sense?
Yes.
I thought the leaders would be here. No leaders are here also. Those who are holding the hands of the affairs. No? It would have been good also. The situation in USA, it is, church started healthcare primarily for the sake of the poor. This is what the Mercy Sisters were holding the hem of health affairs in US. Private players, when this church started, like private hospitals, they started following the Christian network. Then government tried to control. Exactly what was happening to India also. It was mission hospital, then later on corporate hospitals, then policy of health policy has changed. Then what happened was, these private providers and the Christian network together tried to bargain with the government. Missionary sector then identified as a private sector. Exactly what is happening to India. The poor still where they were, and no vocations to religious life. America, hundreds were getting professed, now no occasion. Similar thing is happening in India also. This is when Ascension Health was born out of this crisis situation, and so they took over the mission hospital. Sooner or later it may happen to India also here. Now few questions more. After knowing what is the situation, is the structure a hurdle for us? Is the hospital a burden? Sometimes we find that sustainability and to be in the fray, we find it difficult. Is the hospital a burden? Are the poor our enemies? Is commitment a dream? Has compassion vanished from us? Should we continue the healthcare mission? This is again thinking that all are around the place I put these questions. So I don't know. Is there a way forward? Pope Francis in 2016 he said, health is not a consumer good but rather a universal right, and therefore access to healthcare services cannot be a privilege. It is the basic human right. Now while I have few more slides, in the constitution of our country in India, health is not identified as a basic right. You understand? So there is a problem with us to be in the fray. And then Pope continued in 2016, healthcare, especially at the most basic level, is indeed denied in many parts of the world. It is not a right for all, but it is a privilege reserved to a few, to those who can afford it. That means whose wallets are heavy. Access to healthcare services, treatment and medicine remain a dream only. The poorest are unable to pay and are excluded from the hospital services, even the most essential primary care. Mission hospitals, if we want to be there, we are out of his hands. We need to reverse the order. Communicate from inside out. This is a big theory, and it is actually 20 minutes lecture on communicate from inside out. I will only just give you the gist of it. That means we communicate them first why we are here and how we want to be here and what we will do while we are here. That is why when we say inside out, rather and not, first of all we are telling what we are, that's what we are doing now, and how and why. We need to reverse the order. I need to use examples, it will take time, so I am then create an impact. This BCM hospital is here, we have to create an impact. Educational facilities are here. How many nurses from 1990 onwards we have trained and sent out, They are our agents. But, do we capture their story? Do we make it visible to the public? You know what I mean to say? At least, the impact we have created through this, our presence here, how many people around have gained a job, occupation here, and how they have sustained their families. 2 generations have already born through us and lived through us. Have we ever created a story and published it to create an impact? Instead, that's what we have to reverse the order again. I am telling, create an impact. And then Holy Cross hospitals, the hybrid system, compassion and professionalism. We need to move towards that. Compassion has to be there, but in order to be there in this competitive world, not for the sake of competition, but to be available for the less fortunate, the lowest strata, 40% of the population, especially those in the peripheries which Pope Francis is speaking about. We need to create the vision for our healthcare ministry, and we have also to become the owner of the strategy we employ and align the strategy and the vision together. This is what we will be doing. And then again I am skipping because time is running short, people are also getting nervous. So there is plenty of strength in us. Okay, we Holy Cross sisters will have to, Pope Francis in 2022, reflecting on the story of the Good Samaritan, Pope Francis, means it was an elaboration and reflective thinking. It was a call for consecrated women to be Good Samaritans. And what was he telling? In order to be a Good Samaritan in this biblical story, the Levite passed by, the priest passed by. But this gentleman, what he do? First of all, he stopped there to look at the fallen man. Okay, he stopped there, paused. Then this Good Samaritan approached the one who was already fallen and become a victim of the thieves. So pause, approach, man and also then raised him up. This is what Pope Francis is calling us Holy Cross sisters to do. So Holy Cross sisters launch into a new path, refreshed, renewed and rejuvenated. Why I use this refreshed, renewed, rejuvenated is because the entire province has gone through the retreat of 2023 by Father Nishant. Those of us who have just completed the retreat, we know what the resurrection life means to us. Thank you so much. I know you have taken a lot of pains to organize people present. I thank you for all those who have come. I am greatly indebted to you for your attentive listening. Thank you so much. Let us journey together.